Hi, welcome to this episode of Detroit Peds Talk. I'm Dr. Jameel Smith, Integrated Behavioral Health, Lead Pediatric Psychologist at Wayne Pediatrics, and Clinical Assistant Professor in the Department of Pediatrics at Wayne State University School of Medicine. And today I'm here with Dr. Eric McGrath. He's Wayne Pediatrics Infectious Disease Specialist and Professor of Pediatrics for the Division of Infectious Disease and Prevention at Wayne State University. And March is Reading Month, and supporting literacy development in young people is a priority at Wayne Pediatrics. According to the Michigan School Education Dashboard, in the 2021-22 school year, only 9% of Detroit Public Schools Community District students were proficient in English language arts at the end of third grade, compared to about 42% of all students statewide. And additionally, for families in our community who are experiencing poverty at rates higher than the county and state average, literacy is a powerful tool to combat what we know as a significant social determinant of health. At Wayne Pediatrics, our concern is the whole child, and one way we are focused on improving reading in children within the Detroit community is through participation in the Reach Out and Read program. Dr. McGrath leads Wayne Pediatrics Reach Out and Read program, and I'm so excited to discuss our efforts to improve literacy within our community with him. Welcome, Dr. McGrath.
Thank you for having me today.
Yes. So what is Dr. McGrath? What is Reach Out and Read, and how is it implemented at Wayne Pediatrics?
The basic program for Reach Out and Read is that for the well checks, which kids come into typically from about 6 months to their 5-year-old visit, each time they come in, they get a book that's new and it's age and developmentally appropriate. So the pediatrician can decide based on, factors they know about the child to bring in a book with them, or sometimes they see how the patient's doing and then they go back and bring the book toward the end of the visit. But part of it is to just bring the reading and literacy into the actual visit for the well check as part of the routine clinic visit. In addition, the initiative for the National Reach Out and Read has been to start all the way and add the 0 to 6 months. So that's actually about anywhere between 4 to 5 extra books now. So that started actually in the last year or so, where we're keeping track of the books that we're handing out. And ultimately, the patients that come for their well checks all throughout the entire course, from the time that they come first to the clinic to 5 years old, they end up with 14 or 15 books because they're associated with all the well checks. In addition, at Wayne Pediatrics, we have enough book supply through different partners that we have in the community and our own funding sources to provide books for all the sick visits, as well as books for kids well beyond their 5-year-old visit. So we have books that really are age appropriate all the way up through the teenage years. The only thing is that it gets harder and harder to have a full library of every teenager's interests in the clinic, because they're certainly more varied than they are when they're very young. So the other thing that we do is that the subspecialists actually participate, at least most of them do. And so even for patients who come in regularly to see the endocrinologist for their diabetes, or the kidney doctors or the rheumatologists, they can get a book too. So we don't, we follow Reach Out and Read as it is prescribed, but we actually have expanded it well beyond the actual initial program.
Yeah. How can parents participate in Reach Out and Read at home? So they come in for the visit and they get the materials, the books. How can they participate at home once they receive them?
All you really need to do is just take the book home and actually read it with your child. So for the youngest kids, you would probably read it to them and show them the pictures. One of the things is modeling actually how to hold the book and how to, flip the pages. And sometime in the developmental assessment that we do as pediatricians for well care, we actually use the books in some cases to make sure that kids are developing, and we actually use it as part of their developmental screen on the medical side for screening. But in addition, if you take the books home and read them to your children as they get older and they're developing age appropriate, the child might actually be able to start reading, or at least picking up some of the words and pointing to pictures or pointing to words. And just the idea is that you're engaging, you're sitting with the child, spending time without a screen, if you will. Yeah. And so it's just dedicated time when you and your child are sort of bonding over a book, and hopefully reading will come from that.
Yeah. I'm really passionate personally about literacy development. I used to have a professor who would say how certain children are just bathed in print. And what you're talking about, just having them accessible and around, playing with them, learning how to hold those books, learning how to turn the pages in the right direction, all of that primes them to be able to develop those good literacy skills. Why is improving literacy important in our community, in the Detroit community?
Much like this talk we're having today, Dr. Smitherman had gone through one of our pediatric updates early, maybe 2 years ago or so, and she talked about the social determinants of health, some of the issues related to poverty, and she talked about not only literacy but health literacy being low. And we know that in the Detroit area, there's somewhere around 32% poverty rate, and generally there's been lower literacy rates associated with that, up into some reports quote somewhere around 50% of functional literacy in the area. So what we're trying to do is just make books fun, make books accessible, and hopefully by encouraging the reading at the young age, and what they'll get through school, then their literacy will continue, and they'll actually in some cases have a longer life. There's been research associated with that. Better education, better literacy rates, better job opportunities, employment, and actually health outcomes as well. So the other thing is that we work with different partners in the community. So the books that we receive, we have partnerships with Kiwanis in Detroit. They provide some of our books for the older kids, certainly at no cost to us. And we have other books that we get through the partners with Reach Out and Read, which are Scholastic, and they have a lot of really good prices. Actually, when I'm buying them, I tend to buy 75 or 100 at a time so I can get a good deal on them. And then other book companies, and then we've also had donations from the Nicer Network, which Dr. Secord is a member through immunology. So we have books coming in from a variety. And now I'm really happy to tell you, as one of the first people, that our Reach Out and Read program has been funded for the entire year now by Reach Out and Read Michigan, which is very exciting, as part of the Total Healthcare Foundation's grant to Reach Out and Read Michigan, but specifically for Wayne County clinics that participate in the program. And we're hoping that this will help us, at least our clinic specifically, get somewhere between $3,000 to $5,000 toward buying the board books and the age appropriate books for the program. So it's really exciting to have all these partners and the support too.
That's just wonderful. This is sort of a new question. Why is it important for pediatricians to be doing this work? We know education and teachers are talking about literacy. Why is it important for physicians and pediatricians to be even talking about passing out books?
I just think that the focus for a long time has been, in medicine at least, not so much in pediatrics, but in medicine in general, on pathology, pathophysiology, and more as we study the social determinants of health and they come to the forefront, we see that there's a lot of factors that contribute to health that are well beyond the doctor's office and well beyond medicine itself. As an example, would be just the neighborhood you grow up in, the surrounding sort of air quality or lack thereof, the opportunities you have to sort of get a good employment or a job with benefits and things of that nature. And we're hoping that the emphasis, at least in our clinic and the other clinics that implement Reach Out and Read, will be to emphasize literacy and health literacy, because I think that's the other component, is that if the young patient grows to be the older patient and they learn how to read, hopefully if they're ever ill with a disease or a disorder, the health literacy will help them navigate that for their own sort of participation in management. I think medicine's moved away from everything being sort of dictated from the top down to the patient. I think there's a lot of more shared decision making with that, and I think if the patients are more informed, it's going to help for the better outcomes overall. I really do.
Yeah, that's so important. What results has Reach Out and Read seen in improving children's development?
That's interesting. The Reach Out and Read as a nonprofit organization is evidence-based, and it really makes it different than a lot of the other programs that are advocacy type of programs for children. As an example, it's literally scientifically proven. If you go to their website, you can see the peer-reviewed literature that shows sort of one study after another. There's at least 20 on the website that show higher receptive and expressive language scores for those kids. They literally just have more books at home. And in some cases, studies have shown that the Reach Out and Read books may be some of the only books that are in the home at the young age. Language development is usually earlier, especially if the parents really engage in the program and read regularly and actively. And then there's even one other study that's relatively recent. I think it's on the website, but it was shared with all of our affiliates in the national program. And it came out sort of during the pandemic, so it didn't get that much press, but it showed that basically screens are not as good at teaching as the actual real book, like with paper or in some cases cardboard, like the board books, than the screens. So a lot of parents got used to sometimes putting an iPad or the like or tablet in front of the children and thinking that maybe they'll pick up some language or learning that way. And it's not to say that that's completely useless, but when it was compared head to head with actual books and reading, the kids who were actually given real books and reading initiative actually fared better. So I think that kind of validates us, giving the new books to the kids and not trying to get them, like, for instance, iPads, which of course would be a lot more money, but on the other hand, that we can show that by the research that it's not really necessary. I think that's helpful to the program overall. And it's, as a side note, if I didn't say it already, it's one of the very few, if not the only, American Academy of Pediatrics endorsed programs in literacy for children. So it stands out because it's evidence-based, I think.
Right. And so, once those parents have those books, what are some other ways that they can increase literacy in the home?
Well, we also would like them to consider the program just as a launching pad, if you will, for other opportunities to read or showcase reading in the community. One thing would be to take the children to the local library and work with the library. Now, of course, during the pandemic, many of those programs and whatnot were shut down, but now I think most of them are open again. And in the summer months, a lot of the libraries have very specific student engagement type of programs where kids can get library books or the family can go pick out library books and read them, take them back. And some of them actually even offer like incentives and prizes and things. So that's kind of exciting. And so, like, again, we hope that Reach Out and Read's not just the only, reading that goes on, but that the program is just a springboard, I guess, for other, reading and focusing on that type of literacy issue in the household. So that's the whole point of it, I guess.
Yeah, yeah. Well, you mentioned some of the evidence-based information on the website. Where can parents find more information about Reach Out and Read?
Both the American Academy of Pediatrics website and the Reach Out and Read website highlight a lot of it. For the sort of super nerds, if you really want to dig into it, you can go to the PubMed and actually pull up it's literally indexed in PubMed as far as the studies that used Reach Out and Read as the basis for the research. So there's sort of the higher levels of, where you can get that information. But the websites in general have a lot of information. The other issue, or the other possibility, I guess, is if you come into the clinic and you meet with your pediatrician for the visits, whether they're for, again, well checks or acute visits, you can talk to them more about, what their experience is with Reach Out and Read and what they emphasize or how they use the program for their patients, and get more information that way.
Yes, yes. Well, thank you, Dr. McGrath, for sharing this important literacy initiative at Wayne Pediatrics. Literacy is an important part of your child's well-being, and strong literacy skills can set your child up for a long and healthy life. Our Reach Out and Read program is just one way Wayne Pediatrics helps to nurture your child's overall health. No matter what book you have, I'd like to share some ways to engage your child with the book. Dr. McGrath has shared some. You want to find a comfortable spot for reading so that it's an enjoyable activity. Feel free to slow down. It's okay to pause on the page and explore the pictures that are seen. Third, you want to ask and answer questions together. If you come across a word that your child doesn't know, asking them to make some guesses around what they think the word means. And if you don't know, that's a great way to model for them how even adults have to learn things, and you can explore those unknowns together. It's really how you can capitalize on curiosity and exploration with your child. Embracing wordless pictures, especially for those younger children, those board books that Dr. McGrath talked about, those are great opportunities for you to invent new stories every time. Wordless picture books are a great opportunity to think and talk about what's happening and predict what will happen. And finally, know that reading aloud is for children of all ages, even those middle schoolers. It associates reading with pleasure. This also provides opportunities for parents and young people to share your thinking, discuss why characters make certain decisions and how they're expressing emotions. It really sets the family up for a really engaging activity. For more tips on increasing literacy in the home, please visit the resources we have in our comments. I'd like to thank Dr. Eric McGrath for joining us today and updating us on Wayne Pediatrics Reach Out and Read program. For more information or to make an appointment with Wayne Pediatrics, your one-stop pediatric practice, please visit waynepediatrics.org. Also follow us on Instagram, Facebook, and YouTube for new episodes posting first Wednesday of the month. And remember, pediatricians are the best option for the medical needs of children. Take care.